So good morning, Facebook land. I wanted to do a little video because I had this really fabulous call yesterday with a colleague because I've been doing a lot of mentoring with some other healthcare professionals, chiropractors, physical therapists, body workers, massage therapists, you name it. For people who are using the AO scan device and just are not sure how to use it in their office or like what else they can do. So I had this fantastic call yesterday with this girl. Super stoked, super excited how she's able to further use it as a chiropractor. And she does a lot of energetic based work too, which is obviously right up my alley because I do neurological work. So the two kind of blend hand in hand. So she has the AO scan device. So what I've been doing, and I don't know if you've been following me on Facebook, I like to post all of my success stories and client case studies with people. There's multiple things that you can do with this. Like the possibilities are literally endless. So at the top here, we have a bunch of different things. We have quick scan, we have easy scan, we have, I believe, inner voices next, vitals, body systems, comprehensive, and then my favorite is the Cephi. So quick scan, it's literally that. It's a quick scan. You can do it up to 2 or 3 times a day, morning, afternoon, and evening. If you click on quick scan, there's a bunch of little different categories that come up. I like quick scan for myself because it's a quick way to kind of assess like what are the top 6 supplements that I need for the day. So instead of taking like 20 different things, I'll take 6, the top 6 that my body needs right now at this time. What I use for in the clinic is there are energetic auras, which are here, where you can clear and shield energy. So oftentimes in between client sessions, that's what I'll do. Sometimes when people leave, their energy is still in that room. You can kind of tell like when you walk into a room and someone's just had an argument, like you can kind of feel that kind of energy. So when I'm doing work with people, I don't want that residual waste energy still lingering in that treatment room. So I clear and shield. I'll do the room, and then a lot of times I'll just do myself. Maybe I'm getting tired, or maybe the person that I just worked on maybe like triggered some stuff in me and I don't want it carrying on to the next person. Because you can kind of tell if like your energy is getting dumped into the next few clients that you're seeing. We've probably all experienced it. Like you'll talk to your friends and be like, oh my gosh, like everyone that came in this week was a shoulder issue. Well, it might be because you have a shoulder issue. So that's what I use that for. I have not used the 3-minute boosts on any of my clients. If anything, I do them for me. We have a supercharger, a focus. There's a relaxing one, which I like to play a lot of times. If I have a break during the day, I'll listen to the relax 3-minute supercharge. And the neuroaerobics I really like too. Quick scan. So next is easy scan. Easy scan is what I do on myself every day, up to 2 or 3 times a day. And it's literally just that. It is easy. It is quick, fast. You get vitals, inner voice, comprehensive all at once without going into each individual one to run it. Easy scan gives me my inner voice so I can listen to my voice tones. Sometimes I'll pull them up throughout the day and listen to them. It also will give you only the double reds that show up in vitals and comprehensives. So from a quick standpoint, I can see, let's pull up some here. I can see immediately what chakras are an issue, what meridians may be a problem, and then I get all the double reds for what I need to focus on for that day. So maybe it's changing a couple supplements around, maybe it's just being aware of what I need to do when I'm working out for the day. Again, it's just a quick scan. The other thing that I like that it does is it still gives you your top 6 supplements. So here you have the opportunity then to imprint them. So in the morning when I'm doing this, it takes less than 10 minutes. I'll take my Cybin bracelet off, which also helps to negate EMFs, by the way. Put it on the device, and then I'll scan all those frequencies into the bracelet so that I can, take it with me when I go to work and I'm wearing them. So I can do that 3 times a day. The other thing, next is inner voice. So inner voice is going to analyze your voice for about 10 seconds, and then it's going to give you a readout of the emotional issues that you're possibly dealing with for that day. Inner voice also, if you scroll to the bottom of the report, will show you the physical ailments that are associated with the emotional. So if you do any kind of like neurosomatic work like I do, hypnosis, anything like that, you know that everything that happens physically in the body is affected by the emotions. So sometimes when people have physical issues and they're just not getting better, I'll start to look for like what emotions are going on. So there's two types of body work that I primarily do. One is DNA, which is dynamic neuromuscular assessment, and two is PDTR, which is proprioceptive deep tendon reflex. They all use muscle testing. So the big thing with this device that I really love is it takes my muscle testing to a whole other level, because I can muscle test and get my information, and then I can run a scan on something to kind of double check and make sure I'm getting what I'm getting, or if I missed anything. So it's kind of giving me like that security that, hey, I muscle tested, this is what's coming up, but the device is also saying this or confirming what I've already found. So inner voice, I do pretty much more for the emotional stuff. So maybe I'm working with someone's emotions and maybe anger comes up or grief comes up or frustration or whatever it may be. I can muscle test and figure out like, which emotion is a priority, which one is okay to be cleared. Are we okay to work with this? Maybe what organ is it coming from? Because again, I can see in chakras and meridians what meridians, possibly organs, are going to be affected. So it helps to kind of really guide me in my treatments and then confirm again with muscle testing. So sometimes I will run someone's inner voice in the treatment room while I'm working on them and doing corrections. They can listen to all the balancing tones while I'm working on what needs to be worked on. So again, I feel like it's just like double hitting. It's getting into the issue more potently, because you're able to balance with whatever the physical stuff that I'm doing, the neurological stuff, and then actually the frequency too. So that's what I use inner voice for at work. Again, someone's laying on the table, they had a shitty day, maybe we're doing some emotional work, analyze their voice, play the inner tones music while they're laying there, and I'm working on them. And that's what I use for that. Vitals, I pretty much do more of when I'm doing my functional nutrition consultations. So the vitals for me is kind of like double checking what comes against their blood work. I will read both. If people have blood work, I'll look at it. And a lot of times I can see side by side comparison of like what's going on with both. And most of the times it's pretty accurate between both of them, which is just unbelievable. But the vitals will give me a quick insight of like what stuff is typically going to come up on your blood work, vitamin deficiencies, mineral deficiencies, amino acids, hormones. It's going to let me know if someone's been exposed to mold and yeast and candida, and if so, what kinds, bacterias, viruses, heavy metals, all things of obviously which you deal with when you're involved in that 6-month gut program. So that program, I'm using the device initially for their consult. Every month for their follow-up, they get follow-up scans included with their follow-up appointments. So we do that for 6 months. So for 6 months, I can constantly kind of keep checking and seeing like what's coming up on the vitals report. And then I can shift around, like if maybe some food allergies or food sensitivities changed, we can maybe add, delete foods. I can keep track of like how we're cleaning out some of the viruses. Do we have less mold in our system? So it kind of will help, educate us on what we need to do next, like what's the next step. And it does it like that instant, because it's not like I have to tell the person, hey, you need to go get some blood work done and then wait, weeks, which by then it's already old anyway. So that's what I primarily use vitals for. And possibly if something's coming up in my session, maybe physiological with somebody, I might muscle test and see like, well, is this a mineral deficiency? Is this a vitamin deficiency? If so, which one? Which one does the body need? So I might pull out and quick do a vital scan. Body systems, which is probably my favorite, I like to do after the vitals, because I feel like vitals kind of gives me a quick snapshot of what's going on, and then the body systems gives me a little more in-depth view of what's going on. So body systems is basically scanning all the major systems of the body, like circulatory, endocrine, musculoskeletal, nervous, you name it. What I like about it though is, so like for circulatory, it'll say circulatory physical, circulatory emotions, circulatory vitals, and then circulatory potential causes. So the reason why someone's having a circulatory issue could be these particular physical causes, which could be right internal jugular vein, left mid-cerebral artery. Those are just some examples. The person that I'm working with could also be having some circulatory problems based on these emotions. So these emotions could be stress, suppressed feelings, integrity conflict. So again, we're back to the energy work and mindfulness work. Those emotions could be things that could be actually triggering the circulatory or the endocrine or the musculoskeletal stuff. So you might want to work on the emotions in order to fix the physiological or the circulatory or the endocrine. Circulatory vitals, so these are things that would commonly come up in the vital scan that are affected by the circulatory. One could be vascular resistance, one could be myocardial blood demand. Those are just a few of there's 5 in each category. And then last is circulatory potential causes. So again, some causes of why someone's having a circulatory issue could be estrogen, it could be a red ant, it could be hepatitis A. And literally it goes through each individual category. So if I'm working maybe with someone who has digestive issues, so digestive physical problems could be the common bile duct. It could be internal rectus venous, okay? Those are some physical issues for what could be contributing to the digestive. When we get to the digestive system and we're looking at emotions, so again, if I'm working with someone who has gut issues, I would probably say, hey, we need to deal with these emotions in order to help, heal and further help your digestive issues. Those emotions are associated with sadness, selfishness, dependent, exhaustion, and sensitivity. So again, we could, through our detective work and muscle testing, do some, is this a priority? Is this emotion that needs to be dealt with now? And if so, do we have permission to do that? When we get to digestive system potential causes, so some of the causes of why your person has digestive issues, gut issues, could be tarantula, spiders, syphilis, and then medication or recreational drugs. So those, again, would be things that you'd have to address in some capacity. And it goes through every body system. Like I said, endocrine, lymphatic, nervous, circulatory, musculoskeletal. I said nervous already. It also does respiratory, sensory, the mitochondria, skin, and then chromosomes and DNA. So chromosomes and DNA and mitochondria are pretty important right now, especially if you're working with people who have been injected. So you might want to keep an eye on those. So I use this after I do vitals, because vitals a lot of times will tell me what food sensitivities people might have, but then I'll come in here and then I might see the same food allergies and sensitivities, or I might see additional ones. This one will show me also a lot of chemical toxicities, whereas vitals will just say chemicals. Then I can come in here and see which chemicals are the issue. It also will confirm, so if I see B7 or B6 or B12 coming up on vitals, a lot of times you'll see that come up into the body systems too. So I feel like it goes a little bit deeper when you're looking at what are you trying to work with your client with. And again, depending on what I'm doing with that person, if it's emotional stuff, we'll do emotional work. We'll muscle test, we'll figure out which one's the priority, which one needs to be addressed now, and then, we'll do protocols for that. So that's what I like body systems for. And then we have comprehensive. So comprehensive, I usually use comprehensive if someone's coming in with like last week I had someone come in with a shoulder issue and she wasn't sure what was going on, or doctor wanted her to get an MRI. And so I just went into comp, picked, a couple, I think I picked right shoulder muscles, I picked the ligaments, and then I picked the bones, and I believe I picked spine and ribs. So I could kind of get a snapshot of what was going on in that whole entire area. So when I pulled up the report, I wanted to make sure there was nothing wrong with the labrum, and the labrum was fine. The numbers were where they needed to be. But what I was finding was a lot of ligament dysfunction, so a lot of nines around some of the major ligaments here in the shoulder joint, which is where the person was having pain. There wasn't a lot of soft tissue stuff that came up. There were a couple of issues in some of the ribs. So when I worked with her then with the muscle testing, it confirmed all that. That's what I worked off of. So I did some of my PDTR protocols, did some DNA protocols, threw in some breathing, threw in some movement drills, and then, out the door we were. So comprehensive is a really full comprehensive scan. So again, if someone's coming in and maybe they have some artery issues, you could just scan the arteries. You could do chromosomes with this. So again, this is stuff that I've been looking for with people who've been injected. Maybe I actually had a client a couple weeks ago who came in with some hip issues. And again, she thought she maybe had a tear in her hip labrum. So I just ran connective tissue hip, and it was her right side. So I did right knee too. And then I picked a lot of the lymph around that area, the arteries around that area, and the soft tissue around that area. You can also just do eyes and ears and heart alone. You can do lymph anywhere in the body, arms, head, legs. The lady with the hip, I picked muscles, but I only did I only did hips. You can also do nerves and organs and skeleton. So the lady with the hip, I did pelvis and sacrum. I did vertebrae. I did right foot, and I did legs because I wanted to make sure from a bony standpoint, like nothing was going on. And then veins is the last thing. So there are so many possibilities with this. I literally just use it as a tool to kind of back up what I'm finding and working with in my clinic. The last but not least is Cepheid. So Cepheid has two jobs. Job number one is to broadcast frequencies either individually or in a playlist to a target. That target could be you. That target could be your dog. That target could be your house. That target could be your treatment room. Or you can imprint. You can imprint into a bracelet like I did. You can imprint into water. You can imprint into any jewelry that you wear, any crystals, like literally anything you can imprint frequencies into and then take them with you and wear them. You can imprint sugar pellets if you're into homeopathic remedies. We have all these homeopathic remedies that you can imprint. So a lot of times what I'll do if there's a client who's already in my device, maybe they're just having a shitty day, I'll pick a playlist. So I have tons of a playlist in here, like abundance, allergies, anxiety, brain function. Maybe we just need to sweep through the chakras. I have rescue remedy, which is all the Bach remedies. There are playlists in here for all different types of bacteria and mold and fungus and Lyme. And if you're constipated, maybe you need energy. Again, the possibilities are endless, literally. So while the client's laying on the table, I'll pull up a playlist and just play that playlist, maybe 2-minute burst. Maybe I'll do, continuous. It depends. Depends on what the client needs and how their constitution is. And then, they leave and then I stop the playlist. You can use... So like I've been able to you can clear mold basically out of a house or your treatment room or your office. So right now I have me pulled up as the target, but if you go into spaces and objects, you can put in like your front door if you want to do your house. You can, like I have a picture of my treatment room and picture of my office. So if I want to send frequencies, I would just come up and then change. So like I have Chloe in here, my pup, because I scan her too. And then I have treatment room, workout room, and home. So maybe home, there's some funky stuff coming up. So I'll play a playlist to my home. Maybe I want to give my home some good energy. Maybe I have some mold in a room that I want to clean out. So I'll pull up my home and then play the mold playlist that I have. Or you can play it individually. Let's see. When I put together playlists for people, I always muscle test. So most of the playlists that I have in here have been muscle tested for the particular individual that's on the table. Sometimes it's overwhelming. So what I will typically do is come to the main menu and I will first ask, do they need a playlist or do they need individual frequencies? So I either get a yes or a no. If they need a playlist, then I'll compile a playlist of up to 10 things. If they need individual frequencies, I'll ask, like, do they need 5, 4, 3, 2, 1? And then depending on what they need, I will just run one at a time. If I don't know which one to pick from, I will muscle test and say, do we need quantum reach? Yes or no. Quantum frequency? Yes or no. And I'll go all the way down and get my yeses and nos to see which category I need to start in. So let's go to the detox ones. So these are like all the detox frequencies. So I will muscle test, and they're all alphabetical order. So I can muscle test and say, do we need an A, a B, a C, a D? And then I'll look, and for D, it's dental DT. So I'll add that one to a playlist. So that's kind of how I pick which Cephis. It's literally impossible to go through all of them individually. So I will do them in a grouping. Do we need any in this group? If not, yes or no. If we do in this group, which ones do we need? A through L, and then L through Z. So that's kind of how I do it. Okay. If you have any questions, reach out to me. Like I said, I'm still exploring and trying to find new ways to use this thing. I pretty much use it every day with my clients in some capacity. I do mentoring. I've mentored quite a few other healthcare professionals. So if you have a device and you're kind of just like, geez, I really don't know what else to do with this, let me know. You can get pretty creative with this thing. The possibilities are literally endless.